What did your new patient volume look like? Did you have to grow into it? Were there growing pains? What did that look like?
There were some growing pains, but initially, as I mentioned earlier, we were kind of busy. And so patients were waiting. We had a 3-month waiting period to get in for the practice and whatnot. And I'm like, hey, listen, I got patients out there that are waiting to see me. What if they don't want to wait anymore? Right? So how much money am I leaving on the table by letting these people sit around for 3 months before I can see them? What if I can see them sooner?
Hi, I'm Neil Zemba. I'm the CEO of Rise DDS, and I'm honored today to be at Bloomfield Hills Dental Associates in Bloomfield Hills, Michigan, with Dr. AJ Nafso. So first of all, Dr. Nafso, thank you so much for having me. You have an amazing practice.
Thank you. Thanks for coming.
You know, the crux of this show, and really what it's all about, what we're trying to do is interview the top folks across the country, the top dentists, of which I would certainly consider you in that category, the top dental business leaders, and really get to the crux of what were the actual things that helped you grow and get to where you are. There's a lot of, there's a lot of conferences out there. There's a lot of speeches and talks, and there's a lot of fluff and noise on social media. And so, there's a lot of dentists out there that I think want to understand, very much like me. I'm very OCD about this kind of stuff, where I'm like, all right, how did you really get to where you are? Like, what did you actually do? And I know you're somebody that's very concise. You're no BS, you're no nonsense. You know what you're doing.
Thanks.
And I will also say that something that really inspires me about you and your journey is that you are one of the few, and I don't mean this as a negative thing towards dentists in general, but you're one of the few dentists that I've met that is also a phenomenal business person and a very business savvy owner.
Appreciate that. Thank you.
So, to kick things off, we're here in your office. I kind of wanted to understand, what was your thought process of your name, the logo? Why did you choose this location? What was your thought process? And if you don't mind as well, maybe just kind of explaining, how many ops do you have? How many doctors and hygienists do you have working out of this location?
Sure. Location-wise, first, I think it was just a normal migration. My initial office was in Southfield, Michigan, which is literally around the corner where I went to high school, right? So grew up, hung out there. I mean, the restaurants, fast foods, the neighborhoods, those were all my places growing up. And so my last name would carry weight in that area. So that was pretty easy from that standpoint. And then simply it was just the migration from Southfield, a small practice where I had 3 operatories, to a space that opened up nearby here, which wasn't too far. And I think that really had the crust. The reason for the move at that time was I had a small practice. I had a lot of patients that were coming from in our world here, east side versus west side, and how would they get better access to my practice, or how could I make it more amenable to them, right? Because it's always patient focused. All my decisions have always been patient focused. And so where I'm at right now, and your viewers won't know, but east-west wise, I'm on a main thoroughfare, right? That takes me from the west side of the subdivisions in this area to the east side. So that kind of got me in this area. I was in that space, which had 7 operatories. And again, I had 3 doctors. My wife is also a practicing dentist, 2 other doctors. And then we decided we needed to move. I realized that our patients were waiting for appointments just too long, right? Or we couldn't see them for an hour-long visit for certain longer procedures because chair time, chair space, or chair what's what I'm looking for, accessibility just wasn't there, right? I had to get in a chair and get out of a chair as fast as possible because another patient was going to come in. And so then we came into this practice, and it was funny. This was a big, we went from 1,800 square feet to a little over 5,000 square feet. So that was a big jump at the time, and that really wasn't heard of in Michigan. So opening up 16 operatories was something that everybody kind of wanted to, from vendor standpoint, equipment suppliers wanted to hang their hat on. And so that was difficult at that time, just trying to figure out how we were going to do that and how we were going to accomplish that. And so that's kind of how it started. It was really mostly just trying to find a location that were going to appease my patients at the time.
And so you and Yvette, your wife, obviously practiced together. You've been practicing together from the start, is that right?
She came after me. She's a little bit younger than me, but I've been practicing now as of this last spring, 31 years. She's about 5 years behind me. I graduated from the University of Iowa. She graduated from the University of Michigan Dental School. So we have Big Ten in our blood, which is kind of huge in this area.
I can
and
relate
then
to that.
You can relate to that, good. And so that's kind of how it's, she also grew up in this area, right? So she went to her elementary school middle school is literally across the street. Her high school is still, a few miles away. So her name carried also, everybody knew who she was. So that's kind of just, hate to say it, come back home and work from home.
Sure.
That's kind of what we did.
So you kind of leveraged the fact that you already had a name in the community. You knew presumably a lot of families. Did you leverage that in the beginning? And how did you do that? Did you ask around and say, hey, we're open? Or how did that
you would
work?
think that's kind of how it's going to be, but it tends to work out just the opposite. The people that know you are the last ones that are going to come in. So initially, to build my practice, I went out to local businesses that had greater than 30 employees, and I tried to create some type of program for them through if they had health insurance or dental insurance, trying to create some kind of plan.
Got it.
If the employer didn't offer dental insurance to their employees, then I created some kind of a discount structure for their employees to come see me as their provider. And that's kind of how I worked initially, and then I just kind of grew from there. In our area, which I still have a pretty good, and again, you can imagine, so when I started 30 years ago till today, there's a whole lot more dentists in the area than they were when I started. But we have a couple of big hospitals in the area, and I'm still tied very tightly to all those hospitals because I reached out to their staff members at the time. And they're a great referral source, and they know that I'm always going to take care of them. And so that's sustained us all these years.
And you really held your own, and I think that's a great point. That's a question that I get asked all the time. Obviously, the market has changed so much in 30 years in dentistry and healthcare in general. You have large corporate entities that you just didn't have before. Private equity has felt like they've cracked the code on how to manage things, for better or worse. And so, what's really inspired me about what you've done is you've not only made a lane for yourself and a name for yourself in this community, but your office is a size, the term that I usually use is Disneyland of dental. You've created this destination practice where people will come from. They'll pass lots of other offices to come here. Why do you think that is?
I think it's the culture. I think it's the culture of the staff. I think it's the culture of the doctors. I think we are not just, we are providers of healthcare. We just happen to focus a little bit on the mouth, right? That's kind of our thing. But we look at patients, we look at their health histories, we look at their meds, we treat the whole body, right? We just happen to kind of focus at the very end of our game, if you will, focus on the mouth, right? That's kind of where they're coming in for and the work that we have to do. But again, you've seen commercials, right? An optometrist can tell, or ophthalmologist can tell if you have high blood pressure by looking at your eyes, right? We can tell a lot of things just by the oral cavity, right? It's the same thing. And so with that, we kind of tend to focus on the patient as a whole.
Yeah.
And that's a culture of the practice. So when patients come in, we actually, I think I like to use the word compassion. I feel that we're compassionate. I think that a lot of people will say it but aren't. We're compassionate about our patients. It's important for me and our staff that when a patient leaves, they leave happy. They feel that they were treated properly. They got their chief complaint, if you will, answered and addressed and taken care of. And then the rest is just the rest, right? The rest is just business of dentistry, and everybody has to do that business. That doesn't change for anybody.
That's right. Yeah. No, that's awesome. And at what point? So you said that you had 4 doctors pretty early on when you started. What was your thought process behind that?
I just really felt that at that time I had other other colleagues, if you will. They were opening up their offices and whatnot, and my thought was always, I did a 2-year residency program, right? And I had an opportunity to actually work at other specialty offices and volunteer my time, so I had a lot to give back. So I wanted to bring these. Initially I was bringing these doctors on board and thinking, well, I'd train them for a year, kind of create a mini residency program within my practice because I knew how to do that. Yeah. Right. Having gone through it, and then eventually, if I felt confident in that doctor after a year, then I would ship them out, open up my office, ship them out, and move into that practice. It just really didn't work out that way. I guess life just kind of does what life does. And we ended up going into, a bigger office, bigger practice, more operatories. Even coming in here, I've had other doctors come in, the same thing. They just, it seems like they just want to stay here. They just, they want to stay home, right? They don't want to go out and on their own and open up their, even though we're doing all the work for them, they like that blanket of security being involved in our family at BHDA is what we call it.
That makes sense. I mean, I say that too because I would have been terrified, and I think a lot of folks feel this way. I would have been terrified to open up anything that's more than like 5 ops because that's sort of the standard. I think people have this viewpoint that there's one way to scale, and that's kind of how you build an office in your community, and maybe you do an extension on the property, or you go to another location that can support more ops, but you just went right for it. And so after you first moved in to this location, what did your new patient volume look like? Did you have to grow into it? Were there growing pains? What did that look like?
There were some growing pains, but initially, as I mentioned earlier, we were kind of busy. And so patients were waiting. We had a 3-month waiting period to get in for the practice and whatnot. Hygiene, of course, was always one of those things where no availability. And really, it wasn't anything fancy or, optimum business guy, if you will. But I'm like, hey, listen, I got patients out there that are waiting to see me. What if they don't want to wait anymore? Right? So how much money am I leaving on the table by letting these people sit around for 3 months before I can see them? What if I can see them sooner in that 3 months? And what if I get other people to come help me to see those patients sooner? And if I had enough rooms, right? So some patients will be coming in, and a lot of dentists will understand this, will appreciate this. They'll have a patient that comes in, and again, 5 operatories. So, one operatory is stuck, and you can't bring another patient back in because that patient's not getting numb, or you're having a difficult time doing a procedure. Whatever the case might be, that falls into the things that we do from a day in, day out basis. And also now that patient has to be rescheduled, right? And so just because you didn't have a chair, you're not working. Your assistant's working, your hygienist is working, whatever the case may be, but you're not. You're kind of standing around waiting for an open room.
Right.
That was the other kind of crust of what we're looking to do at the time. And so that was just really when we came in here. It was more of just, again, as I mentioned earlier, it was really just about the patient experience, right? That was it. So if we can get the patients in sooner, make sure that when we see them, if there's a 10 o'clock appointment, they're getting seen at 10 o'clock, not 10:15, not 10:30, not 11 o'clock. I think all those things are important. And then we were able to do that. We've been able to do that, and we've changed our hours here. So literally we're open 6 days a week. We're open from 9 a.m. to 8 p.m. 3 days a week. And so, like I said, it's all based on patients. They dictate how we run our practice.
When did you always have those extended hours, or when did you adopt the weekend hours and the after 5 hours?
Always had like a Saturday option, but evening hours, it just, again, patients requested it, right? And so we call staggered hours, right? So some doctors will start they won't start at 9 a.m., they'll start at noon, work till 8. Sometimes start at 9, get off at 5, right? And then work a half a day, right? Start at 9, work till 2 o'clock, no lunch. The staff really likes that as well too. The staff dictates that, right? So again, patient dictating, staff dictating, everybody's happy, and that makes the day go a little bit better.
Got it. You are probably the first dentist that I had heard of that was adopting so much Medicare. Can you talk a little bit about that? When did you start to do that, and what role does Medicare have in your practice right now?
So we treat Medicare, as Neil was saying, Medicare is the medical portion, right? So it's not the dental portion of Medicare. So Medicare has a dental portion. We bill to the medical portion. We do a lot of surgeries in here, and so some of the surgeries that we do involve, ridge augmentation. The guys will understand what that is, whoever we're talking to out there. Extraction, grafts, cyst removals, things of that nature. Yep. If we're doing a bone graft, then we have to place a fixture to support that, a screw to support that bone graft for future prosthesis. Medicare will pay for that stuff, right? And so for a lot of patients over the age of 65, their finances they're on a pretty tight budget.
Yep.
So if we can, help them out a little bit that way, I think it just works out fantastic for them. We've been able to do that. That's probably about 20% of where our revenues come from, is probably from Medicare medical billing, not dental.
And I think that's fascinating. There's still so many dentists out there and operators that don't know that. I know that for a fact. And that's just such an exciting thing for me. I mean, one of the themes I think right now is what's happening internationally. You know, are we already in a recession? How bad is it going to get? How is that going to impact dentistry? And what you've done with Medicare always struck me as a hedge against that. I just think it's a really smart thing to do, especially for those high ticket cases that everybody's looking for. On the marketing end, we always see, everybody's trying to market for implants. Everybody's trying to market for the big cosmetic cases. And when we look at the actual search results on Google for people that are searching for these things, it's not so much that they are searching for the high ticket cases, it's that they have a treatment plan in front of them and they're like, why do implants cost $15,000? Let me go get a second opinion. Yeah. And you've got people, as you know, that are on fixed incomes. It's very common. So I just thought it was really fascinating how you're leveraging Medicare. And can you just kind of repeat that again? So what percentage of your overall practice does Medicare account for in terms of your overall production?
As far as receipts, so receipts about 20%.
I mean, that's, yeah.
So a lot of that just now, you'll talk about, and how we got into the Medicare billing, right? Let me just kind of backtrack just a little bit, right? I had realized in our practice that a lot of our patients were coming in, younger and older patients were coming in with younger patients with ADHD and older patients with sleep apnea, right? And so that's been in the market. People have heard about that before. A lot of adults now, adult men, for the most part, experiencing what's called atrial fibrillation or AFib, right? It's almost common now for a guy over the age of 50 to have AFib. They're on these numerous medications and whatnot, and that all stemmed from sleep apnea. So we found out that through Medicare, Medicare covers and also commercial plans cover for sleep appliances. So again, patients, right? Everything's dictating. What do we do? Goal is to keep the patients in the office. Right, that we have the patients. There are patients. We house them. We care for them. They don't want to go anywhere else. And so, how do we care for them better? And that's an opportunity for us. So it's not so much that we're bringing in a service and trying to sell that service. It's just the exact opposite.
They are creating the demand. You're just meeting the need.
Exactly. And how do we do that? And how can we help them? So an appliance, a sleep apnea appliance, might run, $3,500. It's expensive for a lot of people, right? So, and usually dental insurance is not going to cover any of it. Even if you have the nice dental insurance, doesn't cover much of it, but Medicare does. Medicare will cover the CVCT, they'll cover the diagnostics of it, and they'll cover part of the appliance. So of the general scope of it, now a patient becomes, now with Medicare like everything else, can you make it affordable?
Right.
We made it affordable. And we're also providing a service, right? That makes sense, and we're helping the patient at the end of the day. That's our goal. Yeah,
I think it's a fascinating strategy. I know that there's so many folks that have heard about it, they're interested in it, but they've never seen someone that's really doing it well. And so, it's just really come to mind for me for what you've been able to achieve. And speaking of things that are in vogue right now, staffing.
Yes.
Nobody can hire anybody. People don't want to work. I don't want to get into the reasons why people don't want to work, but I think people are feeling that. And what are your thoughts on that? I mean, you mentioned culture.
Yes.
What specifically? Is it a payment compensation plan? Is it something like that? What is driving the people want to stay?
Want to stay here.
Yeah.
I think a lot of it is culture. Really putting them into the position of, hey, this is funny, right? Because we're shooting this, right? But I tell my staff members that, and if you look behind us, we have all these chairs, and so these are casting chairs, right? Everybody's going to assume a chair, and you're either in that chair for long term or short term. What's your role here?
Got it.
And so the staff members that are coming in now are, hey, this is where you're going to be. Fast forward 10 years, this is where you're going to be. Now, what do you want your workplace to look like? And we help them with that.
We were talking about earlier, we're looking at standing desks. People wanted a standing desk.
We got them standing
desks. You get them a standing desk.
Yes.
Any other requests like that you notice?
It's just really honestly just little stuff. They want a coffee machine closer to them versus going to the back, right? So this is kind of a silly thing, but I'd rather have them get coffee back here because it saves me time than having to walk to a break room, which is 40 feet away.
For sure.
And make coffee and come back, right? It's those kind of things. Who's answering the phones? those kind of things. So again, it's empowering. I know it sounds weird. A lot of people will give up a little bit of money to feel home. Where they can
Right.
come in, work, they know they're comfortable, they know the culture, they know the patients that are coming in, all those things, and they know that at the end of the day, they're going to leave as happy as when they walked in, right? It's not
Right.
the stress of the work that, if they came in, sometimes they'll come in upset over the weekend or over the night or whatever, and they come in here and it's actually, this is their happy place. I mean, there's always the one patient that will not make it that way, but for the most part, this is their happy place. So I think really as a culture, as far as trying to, get new employees or new staff or what the job market looks like, I think that's, I don't have a silver bullet for that. I don't think anybody does.
Right.
I think we've tried different avenues. I think it's, I think after COVID, I think a lot of schools that were, dental assistant schools, dental receptionist schools, those kind of things, those guys all kind of shut down. I think a lot of people are going off to college instead of looking at trades. We have a lot of staff members here who are working as, dental receptionists or even as a dental assistant. They came back and became a dental assistant who have a 4-year degree in college
Right.
that they do not use. And I think that's the shame of it all. I think they would have had a much better leg up had they right after high school gone to some type of vocational training, got into the trades, and started working.
Right.
And they could have elevated themselves by the time. I have one lady here. I say lady, but she's 23 years old, right? And she started with me when she was 17, and she runs a section of the office at 23.
And is there a lot of upward mobility then, I would assume? I mean, is there a path to being an office manager?
Yeah.
Is there a path?
Yeah.
As I believe in that. I talk,
Yeah, 100% there is.
Yeah.
Again, the opportunity has to present itself because I'm not
Yeah.
going to terminate someone that's really good just to
Right.
elevate someone else, right? Again, it's the family dynamic, it's the culture that we establish here. But you're not going to see an office manager that's making X and everybody else is making Y.
Right.
It's not that step. You know what I mean? It's more of, here's the office manager, she has more responsibilities, and because of that, there's a little bit more pay structure, but not enough that you're going to look at her and say, oh gosh, and some of them don't want that position, right? It's not
True.
worth
True.
they're happy where they're at. At the end of the day, they're happy there. And we set up bonus structures and things of that nature. We look at different ways of, monthly revenues and things
Right.
of that nature. Get them more involved. Like I said, get them more involved in the practice. This is where they spend most of their time, and so let's make them happy where they spend most of their time, and have them have a input as to how the practice moves.
You and I have talked at length about, I know we're both very passionate about empowering the front desk in particular. They're the ones that, like we were talking earlier, the first people to encounter a patient, and they're the last people that they see, before they leave. How do you compensate them? How do you provide those bonus structures? What does that look like?
Actually, I let them dictate that. I sit them down all as a group. It's kind of hard to do that, and I say, look, these are the things that we're looking at from management.
Mm-hmm.
These are the benchmarks that we're looking for. And then I ask them their opinions. If we want to increase those benchmarks, how do you think we can do that? I have my ideas. What are your ideas as far as the team of front desk people, right? And I posed that the same question to my team of dental assistants,
Yep.
right? And I posed that same question to the team of hygienists. What are we doing here to move the bar forward, right?
Yeah.
What can we do so that you guys at the end of the day feel fulfilled that as the office is growing, you're also growing. Maybe not at where you might perceive your pay structure $1 per hour, but
Sure.
from a bonus structure, hey, you know what, I'm involved in that.
Yep.
I have a say-so in that, right? If I work harder than the office does better, I have a piece of that. What that piece looks like is different for the front desk. It's different for the hygiene team, and it's different for the assistant team, I can tell you. They all chose 3 different buckets to play with. Some it's a financial thing. Some of it's, they want, if they hit certain numbers throughout the course of the year, they get, a couple more days of vacation. That kind of stuff is more important to them. Hygiene is the same thing, right? Everybody has a different bucket. So we try and tailor it. That's the best you can do.
So you're empowering them to have more of a stake in the practice.
Mm-hmm.
For folks watching this, you also own 4 other practices.
I do.
You're in the chair, but you're sort of quasi in the chair, and you have the luxury to be pretty much fully out of the chair if you wanted to. I know you don't, but you know, how did you get there? What are some, I mean, I know you're empowering your staff. They're able to, and your team, they're able to, you know, make a lot of these decisions. I've sat in on your marketing meetings before,
Yes.
and I had never seen an office where everybody in the office is involved in what's happening on marketing. I mean, that blew my mind. I loved it. The first time I saw it, I mean, you're whipping out the charts, you're showing them the graphs, you've got everybody in that meeting, and it was a short meeting. It wasn't that
Right.
long. It was like a 20-minute meeting, and they're in there, and then they know what's going on.
Yeah.
And I just was very impressed by that. I thought that was fantastic.
Thank you. I think you know, again, if you're in the business, right? So as I said earlier, as far as like my staff members when they're working at the front desk, this is if you're a dental assistant, and this is going to be you're going to be a dental assistant until you're done, right? And I'll preach this. Well, you want to be the best dental assistant you can be. So just because you clock out at 5 doesn't mean you're not going home and watching it, which is easy this day and age, watching YouTube videos or whatnot on how to be a better dental assistant for a specific procedure. Or, hey, I read about a different material. Hey, doc, the next morning, hey, what do you think about the material? I just read about it. Why don't we, you know, you investigate it from your standpoint, and hey, can we incorporate it into the practice? Those kind of things to help the practice grow. So from my standpoint, I've always looked at it, and from the staff to empower them more is how do we garner new patients, right? That's the game in dentistry, right? New patients, new patients, new patients all the time. That no difference to me.
And everybody's invested in that narrative here.
everybody's
Everybody
invested.
knows what the bottom line is. That's
Yes.
me when I think business person. I'm thinking you can't run a business without money. You can't run a business without production. And I know sometimes business is a dirty word in the medical space, just like sales. But I think it's important to translate that. I don't think it's a dirty word. And I understand, obviously, you know, the separation of clinical and the business, of course, of course. I think a lot of people get hung up on that, and I understand why. I'm not a clinician. I would probably kill somebody if I was. I'm a business person,
Got you.
but I respect the separation. But, you know, again, everybody here is involved in the bottom line. They understand what's going on. Is that right?
Yes, 100%. And again, we're not in the, I mean, we all sell, right? It's just how do you, how is that term used, right? If you're in retail, you're selling a product. In service-based, right? I'm a service-based person, right? And you mentioned earlier, there's people that, you know, I can literally do a 360 right now. Within a quarter mile, there's probably about 50 dental practices. Within a quarter mile, and I'm not exaggerating. And so what we try and do is sell ourselves. So, and how do we sell ourselves, right? And we sell ourselves by the knowledge that we bring to the table, how we treat that patient, how we inform that patient, how we educate that patient. At the end of the day, you know, between intraoral cameras and X-rays and CBCT and things of that nature, and all the other materials we have to help educate that patient within the practice, you know, before and after photos, those kind of things, testimonials and whatnot. It's not so much to sell the service, is to sell ourselves that we're qualified to perform these procedures on these patients, and they feel comfortable, and then that just moves us forward.
Got it.
So I think in our case, we're selling ourselves. We're selling on our abilities and what we can do and what we can't do. We're not really selling a particular service, if you will, right? We spoke about sleep apnea and the sleep appliances. That, you know, we saw a need. We're not selling anything. We just told the patients, hey, we've been talking about this. Guess what? Now I can help you.
Yep.
I've been trained. Let's see if we can help you. And that's kind of how that works out. And that's just evolution of time, right? That's just something, if you always keep your mind forward, again, like we talk about marketing, right? You know, it's always something, right? You hear it's in your face. You know, social media marketing, right? You know, Facebook, Google marketing, Google ads, you know, SEOs. You know, we talk about all that. You and I talk about that all the time, right? What puts you in that parameter, and you're hearing about this stuff, okay? And so I've always been one of the people that, okay, what am I missing out on?
Right.
Am I missing something
that
everybody else is doing? And I've always been that kind of person, and that's kind of led me to, you know, Rise DDS, right? Because I've gone through the gamut of people that have promised me X, Y, and Z, and really have not delivered X, Y, and Z, right? And so that's kind of why I'm here with you.
Well, I appreciate that. And, you know, a lot of dentists talk about bring in hygiene, you assess their needs. Everybody talks about doing a clinical assessment, but very few people, I think, have that pulse on being able to identify that sleep apnea is something that's coming up. Any advice on how to do that, how to know which treatments to target? Because right now I'm looking around, there's so many different things you can do, so many CE courses that you could get into. How do you know what's the right business decision?
I think it's your patients, right? Again, I think it's just which way your patients are steering, right? So again, for me, and again, I guess the easiest thing to do is every office should have this, right? And you can pull it however you want. You can have somebody at your front desk, assign them, if you will, and say, okay, I want a reporting at the end of the quarter. At the end of a quarter, I want to know every referral that went out, every patient that was referred out of the practice. I want to know where we refer them to. Was it to a root canal specialist? Was it to an oral surgeon? Was it to someone who's TMJ
That's a
sleep?
great point. That's a great point.
To a periodontist, to a pedodontist, to an orthodontist.
Right.
I want to know that number, right? And then I can look at what that big number is, and we're all, again, if we want to go back, we're just by ourselves in the office and we're kind of talking between each other. I can say, well, I referred 30 orthodontic patients.
Yep.
That's how much per patient.
I'm losing it.
I just sent someone.
I'm sending it somewhere else.
We talk whatever numbers, I'm sending it to someone else.
Yep.
Is it in my purview to be able to learn how to do that?
Yep.
Right? And what would it take for me to learn how to do it? Not a weekend course, right?
Right.
Take, really get in, right? Because at the end of the day, God forbid if something were to happen or you do something wrong and you find yourself, and I always do this, you find yourself in a courtroom, right? They're going to gauge you based on a specialist, not as another GP doing the work. It's the specialist doing the work.
Sure.
So you want to make sure that you have, you have that background that you need, and then you start slow, right?
Yeah.
And now you look at another quarter, and it's not 30 patients now that you referred out, it's 20, and then it's 10, and then now you're like, when you get to with me over the years, now it's 3 or 4, and those patients need orthodontic surgery, they need extractions, they need serious,
something
they have,
crazy.
Developmental issues, they need someone that needs to help with the growth patterns and whatnot, and that's just not something
And then you can also identify that too.
Yep.
Really, explain the scenario, and I'm sure that they appreciate that as well when you're referring it out. So I think that's phenomenal.
And I think that's kind of one easy way of doing it.
Yeah.
I think that's an easy way to figure out where you want to go with that.
Yeah.
And then your skill level, right? What's your are you someone that likes to just do surgery? Someone that likes to see kids a lot, right? Then you kind of want to gear your practice that way, right? And kind of make yourself a pediatric dentist. Make yourself not the top periodontist in the city or whatever, but hey, the third guy down the street.
Yeah,
not
market yourself as a specialist necessarily, but we do it. It's a one-stop shop. I mean, how many people ask for the concept of the one-stop shop, the community dental practice? We talk about that all the time. I mean, yeah.
But I think the focus is when you're saying, like you brought up hygiene, I think the focus should be that when a doctor walks into that hygiene, right, a hygienist focus is on the teeth and the gums. That's not your focus.
Right.
That's easy. Right, it's first thing you want to do is assess their medical condition. Right, can I even so much as touch this patient? Do I want to touch this patient?
Right.
Do I want to treat this patient?
Yep.
And then what have they been going through? Right, what's been happening with them? What's their life like? What's their lifestyle like? And then you get into you start creating that relationship. You start creating what you are here as BHDA, the culture, the family of the practice, and you're bringing that patient into that family of practice. So just as a family member, you want to take care of them. Right. And that's kind of what you want to do. So I think that's when you come into that. Now you can look at, hey, man, doc, I'm tired. Well, why are you tired? Well, I don't sleep very much. Well, why don't you sleep very much? My wife says I snore a lot. You might have sleep apnea. Right? When's your last sleep study? This is just, look, within 15 seconds, I got to someone that's going to go for a sleep study. Yeah. And I'm going to get an appliance just because I asked the questions.
And I know you do this too. You have essentially these very simple high level questions. You're right. You can, I could see it being 1 to 3 questions that you ask somebody to figure out, okay, are you a potential sleep apnea patient? Are you,
Sure.
Even things like, do you need an implant? How many people do we have come in with emergency cases that come in for an extraction? They don't know what an implant is.
Yeah.
We talk about this too. Nobody knows what an abutment is.
No.
We know what an abutment is.
Yes.
Nobody knows what an abutment is. I don't care who you are. I don't care where you live. It doesn't matter. And so a lot of people, I think there's an assumption that, if you have enough of an impact with cold traffic, people coming in from Google searches, this kind of thing, you know, I always say all the time, even as the Google guy in dentistry, the best patients that you can get are always going to be your existing patients. And I'm always blown away by the lack of really investigating that, because I think people think it's a chore. But, you know, to your point, I mean, you could have a little cue card with a couple questions that you ask every patient. It doesn't even need to be in the same appointment. You know, it doesn't have to be a full 21 questions interview, but you could just maybe kind of, and then obviously to your point, you're kind of being guided there anyways by what they're saying. I just think that's a phenomenal thing that a lot of people can implement pretty easily.
And I think, listen, what you guys are doing for us at Rise is just making us, you know, for me anyway, right? I start really looking at, you know, and maybe a little more so than other people, right? I start looking at, you know, who you're marketing to, what's coming through my door, right? How's that marketing?
I can attest to that.
Yeah. How's that marketing impacting the culture of my practice, right? What's happening, right? And again, because I said I've had numerous marketing agencies, right, that have come in and promised X, Y, and Z and with no deliverables, right? What's great is that I do like a certain type of patient that walks through the door. A patient that's more, and I hate to, and not a certain type of patient, a family-oriented patient, right? Someone that wants to be part of a family, wants to be part of a practice, appreciates what we do here, being an all-in-one shop, if you will, and being able to have that feedback with you guys has always been good, right? Because we can tweak, which is always nice, and it gets me where I'm at today.
Well, I appreciate that. And my last question is, you have been the only office in my career that was literally academically, you know, down the line doing every possible thing that you needed to do organically on Google with all your social profiles. You have what we call practitioner profiles, where you've got your main Google My Business, but then you've also got a separate Google My Business profile for all of your main practitioners.
Yes.
How did you know how to do that? I'm just curious.
You're going to laugh, right? Because there's no really good story, except for we had a slew of patients that were coming in and they thought they were seeing me.
Got it.
So they say, I'm a patient of Dr. Nafso. When they weren't a patient of mine, they were a patient of another doctor within the practice. And I'd never seen this patient before.
Yeah.
And I said, the problem happens now is that doctor is not getting any notoriety. The other doctor is not getting any notoriety, right? So if I'm searching someone, if I'm searching Bloomfield Hills Dental Associates, that's great because all of us pop up. But what if I want to search just for me, Dr. Nafso, right? What do I look like? You know, who's out there? What are my reviews? And these other doctors that are out there, so they have their own profile. And that way now people tend, it's just notoriety, just people getting their name out, right?
And speaking of how do you get freedom to get out of the chair, if you want to, there's your perfect example. And I get asked all the time about that strategy. Well, what if they leave? And I say, look, you can just replace the name of the doctor in the profile. You want to put it in your employment agreement, in your employment agreement, that those profiles are owned by the practice, not their likeness, but you know. And so with a couple easy steps, I mean, you have full control over these profiles. They're incredible profiles. We did an experiment a couple years ago with one of our own practices that's got, I think we have like 700 5-star Google reviews, and my partner would hurt me if I messed that up. And I was like, Roger that. So the test was, if I bring in another profile for him as a doctor, we had 3 doctors. If I created each of those doctors a separate profile, would it cannibalize my traffic from that main profile, or would it pull more traffic in from the larger market? And it's very much the second one.
Second one, yes.
So it's so funny because we talk about that all the time. I'd never seen another practice doing that until we looked at your office.
Listen, it's going to sound, you know, it's name recognition, right? So these guys are out there, they're living in this, they're working in this community. They're in here, they're leaving here, they're, you know, going to lunch in the area, they're going to dinner in the area, they're hanging out in the area, there's kids go to school in the area. Their name should have a presence, right? And that's kind of really, there's no big, you know, ta-da moment. Is just one of those where I said, okay, it just didn't make.
People like people. People like working with people. Some folks want a female dentist. They just do. It's a preference. Some people want this, that. I mean, it's or to your point, they might know of somebody in the community. Typically, to your point, it's a great review that they've gotten with a certain doctor. Obviously, doctors that specialize in certain things. It's great for that. So Yeah.
I think a lot of it comes down to, and it's going to be kind of funny, but people especially who leaf through the patients that come in, not through any type of marketing that we're doing, but we just belong. We're on their, they look through the Blue Cross Blue Shield, their insurance booklet for
I was
providers.
just going to say the same thing.
Right.
Yeah.
And then they really
Yeah.
just they get a highlighter out and they start doing their homework, and they're like, okay, who's in my area? How
Yep.
far am I willing to drive?
Yep.
That's
Yep.
kind of how they start.
Yep.
And then from there, they go now to now Google, right?
Yep.
And they start searching, right? Who has the best reviews, and why do you have the best reviews, and who do you see, and then photos and history, right?
Yeah.
And then how many doctors you have, hours availability, those things again, patient base.
Yeah.
How are you going to attract those patients? And it's patient based, right? So they come in like, I loved your hours. You're 15 minutes away. There are some closer, but you're open till 8 p.m. It works for me. That extra drive is not an extra drive.
I know
now.
I can rely on you, and when I come back for hygiene, I know that I can
Get in,
have
an
extended
appointment.
hours. And we
Yes.
say this all the time too. Folks with jobs that they have to be at, folks with jobs, period, tend to not want to skip their 9 to 5 to go to a hygiene appointment. They might do it for a bigger procedure, but I don't know anybody that would miss work, especially right now, to come in, and that's just an honest truth. I'm just being honest. I don't know people that would skip that to do hygiene.
So you want a pearl? You said you want a pearl, right?
I do.
Can I give you a pearl?
Yes.
So if most of your patient base are, you think they're 9 to 5 employees, right? Or they own their business or whatnot,
Yep.
and they're not sitting there with their phone, right? Or they can't answer their phone, or they can't make personal calls while they're working during the day, right? So if you have your staff members trying to call and confirm these patients, or
Right.
schedule an appointment, or ask them questions or whatnot about their insurance, or an upcoming appointment, what have you, you're not going to get a hold of them between 9 to 5, right? So it'd be to your benefit to actually hire someone to work from 5 to 9, and they can work solo. You don't have to be here. You don't have
And they're
to
just
oversee them.
focused on that.
Yeah, they're trained, they're focused. This is what you're going to do. You're going to call these 20, 30 patients. You're going to confirm these. You're going to do these. You're going to go over this insurance. We can pull insurances, right?
Yeah.
We just can't talk to the patient yet.
Right.
And so 5 to 9, twice a week, that person's invaluable. And your staff now during the day can save a ton of time, because they're not on the phone calling people that aren't going to answer their phone and leaving a message, because if they're at their workforce or their workplace, their manager says no phones, right? And you're kind of stuck. So that's a little pearl for everybody.
Appreciate it.
You're welcome.
Dr. Nafso, thank you so much for having me
No,
again.
Thank you. Appreciate it.
Thank you for your time.
Anytime.